Hi, Najee here from Phoenix Rehab again. So there are two tests that we do in our clinic to test for the presence or possibility of having carpal tunnel syndrome. And they are number one above there is Phalen's test, and number two is Tinel's test. No, it's not Phalo test or it's Phalen's test. Right. So I'll demonstrate them to you. Okay, and you can do this anywhere you want, at the home, in the office, when your car is parked or something. Okay, so the Phalen's test is this. So you take both your hands this way, then you put the back of your hands towards each other this way and bend. This compresses your wrist and your carpal tunnel the most, and you hold it there for 60 seconds. Okay, so what we're looking out for is we're looking for the telltale signs of carpal tunnel syndrome, which is tingling, numbness, pins and needles across the thumb, index finger, middle finger, and long half of the ring finger, as well as 75% of the palm. So basically, what you're looking out for: tingling, numbness, pins and needles across here. So when you do this test, this Phalen's test, within 60 seconds, if you get any sensory loss, sensory changes, numbness, tingling, pins and needles, it's a yellow flag to indicate that you may have carpal tunnel syndrome. Okay, and what you should take note is two things. Number one, okay, how fast the symptoms come in, how fast your numbness, your tingling, and your pins and needles come in is an indicator how severe your carpal tunnel is. Okay, so let's say, for example, I have two patients, right? If one of the patients, they do this test, and both of them do this test. Say patient A, the pins and needles numbness comes in at the 55th second, as opposed to patient B who does it and within 10 seconds they have the symptoms ready. So which got it worse? Most likely patient B got it worse, because patient B who developed the symptoms in 10 seconds is more advanced in the condition compared to somebody who develops the symptoms within 55 seconds. Okay, that's number one to take note of. Number two is that when how intense. So let's say patient A, patient B again, right? But this time, let's say they do the Phalen's test, and patient A, or no, let's do patient C, patient D. Patient C, patient D do Phalen's test again. So patient C will say, "Oh my gosh, when I do the Phalen's test, my finger becomes so numb that I cannot feel anything. I will just drop. I can't do anything right now." As opposed to patient D who does the Phalen's test and say, hey, I can feel a numbness and it's not so bad, maybe 15-20% of numbness. So obviously patient C who has very, very numb symptoms after Phalen's test is much more advanced, has a much more advanced carpal tunnel syndrome as opposed to patient D who has only about 15-20%. So how fast the symptoms show up and how intense they are is an indicative of how advanced your carpal tunnel syndrome is. So that's Phalen's test, not Phalo test. And then after that, second one. So second one is called a Tinel's test. Tinel's test is a tapping test, right? So say it's my left hand that I'm thinking that may have a carpal tunnel syndrome. So I use my unaffected right index finger. I will tap from the very tip furthest away from the median nerve distribution. And you know the median nerve distribution is from the wrist, and it distributes sensation up from the thumb, index finger, middle finger, and long half of ring finger, right? So I'll start tapping at the thumb tip, right? Like this thumb tip, and then the index finger tip, middle finger tip, and then a ring finger tip, and I tap along the surfaces. So if what we're looking out for, we're looking out for sensations like a electrical jolts, electrical sensation, sensation of that sensation with lack of sensation. So and how intense they are. So if there's anything that you feel, oh, there's some electrical sensation, especially at the very tip, that's also indicative that the possibility of having carpal tunnel syndrome, right? So these are the two tests that we do in our clinic for Phoenix Rehab. So, but the clearest and the most definite test is when the orthopedic surgeon will send you to do a nerve conduction test to check whether how much in terms of percentage, how much how much electricity is conducted in the median nerve. And that's really clear to show you how much obstruction there is or how much function the median nerve is doing. But most of the time, Phalen's test and Tinel's test is more than clear enough for you to take action to treat your carpal tunnel syndrome. If you need us to advise more, just comment below. We'll also be happy to refer you to any orthopedic surgeons. If you need any advice, just let me know. Reach out to me or comment down below. Take care. See you. Bye.